Hello everyone, today I am going to explain you about the topic renal tumor. Okay, this is very important topic that is highly asked, okay, maximally asked in the NEET PG entrance examination. So in the previous video I have talked about the various systemic disorders that lead to kidney disorders. Okay, so now we are going to discuss about the renal tumor. Okay, and this renal tumor is a vast topic. Okay, and this vast topic covers maximum MCQs. Okay, that is going to ask in your entrance preparation examination. I will clear every concept. Okay, and that concept will help you in solving every MCQ. So we start from the renal tumor. Renal tumor can be classified as benign tumor as well as malignant tumor. Okay, benign tumor as well as malignant tumor. It is classified into benign tumor and malignant tumor. Now benign tumor, as we already know, benign tumor means that is unencapsulated maximally. Usually these benign tumor, they are unencapsulated tumor. They are, one is angiomyolipoma and oncocytoma. Okay, angiomyolipoma and oncocytoma. So angio means blood vessel, myo means muscles, and lipoma means fat cells. So in this tumor you will see the proliferation of the blood vessel, muscle cells, as well as the lipid means adipocytes. They will be proliferated. Next is malignant tumors. Okay, in the malignant tumors we have Wilms tumor. Okay, Wilms tumor and renal cell carcinoma. So maximum questions are going to ask from this Wilms tumor, that is the tumor of the childhood. Okay, next will be the renal cell carcinoma, that is the tumor of the adults. Okay, now first we going to start from the renal oncocytoma. So in this topic renal tumor, maximum facts are going to ask. Okay, so we have to learn every concepts as well as some fact as well as image based questions. Okay, so that I will discuss later, and I will explain you each and every how to diagnose, how to identify the figure. Okay, that is important. Now first there is renal oncocytoma. So this renal oncocytoma, it is a benign tumor. Okay, now it arises from the intercalated cells of the collecting duct. Next, gross appearance is, it appears tan mahogany brown in color. Okay, tan mahogany brown in color. Okay, so that is its color appearance, and the kidney will appear mahogany brown and tan in color. Now microscopically if we see, there is presence of the oncocytes. Okay, there should be presence of oncocytes. Oncocytes are the cells with the abundant eosinophilic granular cytoplasm. Okay, why there is the cytoplasm appears as granules, right? Because of the excess mitochondria. So these mitochondria, which are excess in number, they are making the cytoplasm of the oncocytes to be more granular. Okay, so these oncocytes are not the characteristic feature. Okay, it is also found in other diseases as well, like in Hashimoto's thyroiditis. Okay, in Hashimoto's thyroiditis there is also presence of the oncocytes. So these oncocytes are actually abundant eosinophilic granular cytoplasm possessing cells. Okay, cells having abundant eosinophilic granular cytoplasm. Okay, now next we can see the figure of the renal oncocytoma. So this is the figure of the renal oncocytoma. Okay, so these renal oncocytoma, you can see these are the cells. Okay, these are the cells with highly eosinophilic abundant granular cytoplasm. Okay, these are the oncocytes. So if you see, this is the figure of the kidney. Okay, and it's not a normal kidney, it is a kidney having benign tumor, that is renal oncocytoma. Okay, so you can see this is the abundant eosinophilic means pink colored cytoplasm. So these are the cells with abundant pink colored cytoplasm, and they are known as renal oncocytoma. Okay, this is also, you can see side by side, this is the normal. Okay, this is the normal kidney, and this is the kidney having affected by renal oncocytoma. So this is the normal kidney. You can see these are the glomerulus. Okay, now these are normal kidney. Okay, but here you can see there is nodules of the group of cells, and these cells are the oncocytes. Okay, these cells are actually oncocytes. Okay, these cells are oncocytes, round cells. Okay, round cells, abundant cytoplasm, and the cytoplasm are pinkish in color. So I think you have understood how to identify the image of this renal oncocytoma. High power view of oncocytes. Okay, you can see this is the cell. Okay, this is the oncocyte cell, and you can see there is granular cytoplasm. Okay, cytoplasm is granular. Okay, cytoplasm is granular due to the abundant mitochondria, and you can see the nucleus here. So these are the oncocytes. Okay, these are the oncocytes. Okay, remember these are the oncocytes. Okay, these are the oncocytes, and these oncocytes are also seen in other diseases like Hashimoto's thyroiditis. Okay, Hashimoto's thyroiditis. This is another MCQ. Okay, Hashimoto's thyroiditis. Next tumor that we have know is angiomyolipoma. I have already said you that angio means blood vessel. Okay, angio means blood vessel, and next we have the muscles. Myo means muscle, fat, lipoma means fat. So these in the microscopy you can see there is presence of three things. Okay, first there will be presence of the, you can see there is the presence of the blood vessel. Okay, there you can see these are the blood vessels. So there is presence of the proliferation of the blood vessel. Blood vessels are present in large number. Next you can see there is presence of the fat cells. These are the adipocytes. Okay, these are the adipocytes. So there is proliferation of the fat cells, adipocytes, and next there will be the proliferation of what? There will be proliferation of the muscles, spindle shaped muscles. You can see these are the spindle shaped muscles, and they are proliferated in a large number. Okay, so there is this. So this is the figure for angiomyolipoma. This is the best figure. Okay, you can see here the blood vessel. Okay, blood vessels are proliferated. Then there is presence of the fat cells as well as there is muscles proliferation in this figure. Okay, so this is the angiomyolipoma. Okay, next topic that we are going to discuss is that is Wilms tumor, which is a malignant tumor. Okay, this Wilms tumor is a malignant. I have already told you that this Wilms tumor is a malignant tumor. Okay, it is occurring in a childhood, like it is occurring in age group of 2 to 5 years. Okay, now what is the gene get mutated for any tumor to occur? There should be involvement of genes. Okay, so in the case of Wilms tumor, the gene involved is Wilms tumor gene 1 and Wilms tumor gene 2. Okay, and these Wilms tumor gene 1 is affected, that is present on the chromosome 11p13. Okay, and Wilms tumor gene 2 is affected, that is present on chromosome 11p15. Okay, now what is the precursor lesion of the Wilms tumor? So the nephrogenic cell arrest are the precursor lesions for the Wilms tumor. Okay, that is asked in your examination. WAZR syndrome. Next is Dennis-Drass syndrome. Okay, Dennis-Drass syndrome, WAZR syndrome, Dennis-Drass syndrome, Beckwith-Wiedemann syndrome. Okay, so first will be the WAZR syndrome. So W stand for Wilms tumor. Okay, A stand for aniridia. Aniridia means loss of the iris muscle. Okay, now G means genetic abnormalities. Okay, G means genetic abnormalities, and R means retardation. Okay, so these are the points. Next we have the Dennis-Drass syndrome. Dennis-Drass syndrome, there is three symptoms. Okay, first will be the WT means Wilms tumor. There should be presence of Wilms tumor. There should be gonadal dysgenesis and diffuse mesangial sclerosis. Okay, so these are the symptoms seen in Dennis-Drass syndrome. Now Beckwith-Wiedemann syndrome. Beckwith-Wiedemann syndrome, there is presence of Wilms tumor. Hemihypertrophy. Okay, hemihypertrophy means only one side of the body's organs are increased in size, whereas other side they are in normal. Okay, macroglosia means increase in the size of the tongue. Okay, now this tongue is examined in other conditions, not only in this Beckwith-Wiedemann syndrome. Macroglosia is present, so in amyloidosis also this macroglosia is also present in amyloidosis. Okay, so in amyloidosis also we have to examine the patient tongue. Okay, so in the case of amyloidosis. Okay, now what is the best biopsy site for the amyloidosis? It is the abdominal fat or the fat pad. Okay, the best site for the amyloidosis is the abdominal fat pad aspirate. And the second best site for the amyloidosis is rectal biopsy. Okay, second. So we can write here the first site. Okay, first site would be abdominal fat pad biopsy. This is the first best site. Okay, this is the first best site. Now, second best site would be what? It would be rectal biopsy. And the third best site would be gingival or tongue biopsy. Okay, so this tongue would be examined in the case of amyloidosis. Okay, now next this hemihypertrophy, after that macroplasia. Now in the case of this Beckwith-Wiedemann syndrome, also there is presence of hepatoblastoma, and next there will be adrenocortical neoplasm. Now what is the microscopic feature of this Wilms tumor? Okay, what is the microscopic feature of this Wilms tumor? So this Wilms tumor is a triphasic tumor. Okay, triphasic tumor means it consists of three different class of cells, three different foci of the cells are present in this triphasic tumor. So what are the three different kind of cells? These are coming from either epithelial element, mesenchymal element, and blastemal element. So they will form three different class of cells. Now epithelial cells elements, they are present in the form of glands, tubules, as well as rosette. Okay, now the mesenchymal elements, they are present in the form of spindle shaped cells, whereas blastemal element, they are actually, this blastemal means they are something representing to the embryo. So they will be primitive cells, and they will be dark blue small primitive cells, and that's why this Wilms tumor is also known as small blue round cell tumor of the childhood, because it possesses the blastemal element as well. So most important prognostic factor. Okay, if this factor is present, it means the tumor has a poor prognosis. On treatment, it won't get treated, it won't get cured, it will lead to death of that patient if this feature is present. Okay, that is known as histologic anaplasia. Okay, that is known as histologic anaplasia. If the histologic anaplasia is present, it means there is poor prognosis, the patient is not going to cure by any medications. Now next is the renal cell carcinoma. So this renal cell carcinoma is also one of the malignant tumor. Okay, this renal cell carcinoma is also known as renal adenocarcinoma. Okay, now the age group that is affected by this tumor is 60 to 70 years. Okay, patient, and more the male is affected in this case. The most common risk factor is smoking. Okay, smoking is the most common risk factor, and this renal cell carcinoma is also known as Graves tumor. Okay, it is also known as Graves tumor. Okay, you may get confused by the names, but you have to remember. Okay, now next risk factor is the obesity, petroleum products. Okay, petroleum product, chronic kidney disease. Chronic kidney disease, most commonly the patient used to go for dialysis. Okay, so if the patient is doing dialysis for a long period of time, then the person is more likely to get renal cell carcinoma. Okay, next factor will be asbestos. Okay, now the Stopper syndrome, there is a Stopper syndrome, and it consists of renal cell carcinoma and the hepatic dysfunction. Means what is the disease in which the liver as well as kidney both are affected. Okay, that is one Stopper syndrome. In this Stopper syndrome, there will be renal cell carcinoma as well as there will be hepatic dysfunction. Okay, that is Stopper syndrome. Now this Graves tumor, what is the clinical feature of this Graves tumor? So Graves tumor, there will be flank pain. Okay, there will be flank pain, there will be hematuria, there will be abdominal mass. So abdominal mass is present, okay, as a characteristic feature. This abdominal mass is also present in the Wilms tumor. One thing we have to care about, that this neuroblastoma and nephroblastoma. Okay, so these abdominal mass is present in both neuroblastoma as well as nephroblastoma, and this Wilms tumor is also known as nephroblastoma. Okay, now next we are going to discuss about the paraneoplastic syndrome that are associated with renal cell carcinoma. Okay, paraneoplastic syndrome that are associated with renal cell carcinoma. First will be hypercalcemia. Okay, first will be what? Hypercalcemia. Okay, next will be polycythemia. Okay, increased erythrocyte sedimentation rate. Now the different types, histological types of the renal cell carcinoma. What are the histological type of the renal cell carcinoma? First one would be this, that is known as clear cell renal cell carcinoma. Okay, so this is the most common type of renal cell carcinoma. Okay, now solitary lesion. Okay, the lesions are single. Okay, and it involves only one kidney, not both the kidney are involved in this condition. And what is the mutation? The gene affected will be BSL gene, that is called as von Hippel-Lindau gene. Okay, so von Hippel-Lindau gene is affected in this condition. A microscopic feature in the case of clear cell renal cell carcinoma, there will be sheet of the cells with clearing. Clearing means what? Why this term written as clearing? Clearing means clear cytoplasm. Okay, clearing means clear cytoplasm. And this clear cytoplasm, why there is clear cytoplasm of a cell? Because of the storage by the glycogen as well as fat. Okay, the fat and the glycogen, they get stored inside the cell, so the cytoplasm get cleared. So clearing of the cytoplasm, and they will be pass positive as well as they will be oil red O stain positive. So this is also important question that is going to ask. Okay, now next tumor that we have is papillary renal cell carcinoma. Okay, so this papillary renal cell carcinoma, this is the second most common. Okay, this is the second most common renal malignancy. Okay, second most common renal malignancy, and it arises from the PCT and or DCT. Okay, most commonly it arises from the PCT, then DCT, and it is multicentric. It has multiple lesion. Okay, and it is bilateral. It affects both the kidney, and it mainly occurs due to the long-term dialysis. Okay, patient with chronic kidney diseases like diabetes. Okay, so that person may affected with this disease. And this papillary renal cell carcinoma also shows amyloidosis, and there is deposition of A beta 2 M protein, means A beta 2 microglobulin. Okay, so beta 2 microglobulin cannot be filtered from the kidney. Okay, so it get deposited inside the body in the kidney as well, so it will lead to the amyloidosis. So the microscopic feature of this papillary renal cell carcinoma is the papilla. Okay, so there will be presence of the papilla, and the papilla are the finger-like projection that are lined with macrophages. Okay, so in this we have the presence of the psammoma bodies. Okay, psammoma bodies are not the characteristic feature of this papillary renal cell carcinoma. They are also present in other conditions, like in the papillary carcinoma of the thyroid. Okay, it is present in meningioma as well as in serous cyst adenocarcinoma of the ovary. Serous cyst adenocarcinoma of ovary, they are also present in prolactinoma as well as mesothelioma. Okay, so along with the psammoma body, there is also presence of foci of the calcification. Okay, there is presence of foci of calcification. Other histological type of renal cell carcinoma is chromophobe renal cell carcinoma. It has the best prognosis. Okay, if it is diagnosed, it can be cured, okay, on time. And it arises from intercalated cells of the collecting duct, and it is associated with Birt-Hogg-Dubs syndrome. BSD gene mutation is occurring in the chromophobe RCC. Okay, now what are the microscopic features in the chromophobe RCC? First, there is polygonal cell with defined boundary. Okay, polygonal cell with defined boundary, resinoid nucleus and perinuclear halo. Okay, that is also seen in coeliocytes. Now the special stain for the chromophobe renal cell carcinoma is the Hales colloidal iron stain. Okay, and this stain it can stain the coeliocytes. Okay, so coeliocytes, they look like a plant. Okay, now next is collecting duct renal cell carcinoma, and it is the carcinoma with worst prognosis, and it is the least common type of renal cell carcinoma. It arises from the collecting duct. Okay, now the microscopic feature of this collecting duct renal cell carcinoma is the hobnail cells. Okay, just like the hook of the carpenter. Okay, carpenter uses the nail. Okay, and this will appear like the nail. Okay, they will appear like the nail of the carpenter. Okay, so that's why they are known as hobnail cells. Okay, and next is desmoplasia. There will be dense fibrosis. Okay, So that is desmoplasia. Next will be medullary renal cell carcinoma. This medullary renal cell carcinoma, it is associated with sickle cell trait. Okay, so there will be no any disease, but there will be trait, that is sickle cell trait, and there will be deficiency of SMARCB gene. Okay, now we should look for the Wilms tumor. Okay, so Wilms tumor microscopic feature. Okay, so Wilms tumor is a triphasic tumor and it consists of three component. Okay, it consists of three component. First component in the form of epithelial. This is the microscopic feature of a Wilms tumor. Okay, in the Wilms tumor, it is a triphasic tumor, so it consists of three different type of cells. Okay, it consists of epithelial cells, blastemal cells, as well as spindle shaped cells. Okay, so one epithelial components, they are arranged in the form of glands. Okay, you can see they are arranged in the form of glands, or they are arranged in the form of rosettes or tubules. Okay, that is the epithelial component. Next is mesenchymal component, or the stromal cells. Okay, they are arranged in the form of spindle shaped cells. Okay, just like the muscle cells. Okay, these are arranged, you can see here, these are arranged in the form of spindle shaped cells. Okay, next will be the blastemal component. Blastemal component means something like the embryo. So they are the primitive cells and they will appear dark blue, okay, small and round cell. Okay, dark, small, blue and round cells. So these are the blastemal components. So in a single tumor you can see three type of components. Okay, so this the epithelial component, okay, blastemal component and the spindle shaped cells. Okay, next you can see the hand drawn image, that is one epithelial component in the form of duct. Next is the stromal component in the form of spindle shaped cells. Okay, they are blastemal cells, they are small round and dark blue cells. Okay, now next we have the clear cell renal cell carcinoma. Okay, this clear cell renal cell carcinoma is the next one. Okay, in this clear cell renal cell carcinoma, there is cells, they are totally clear. Okay, you can see in this figure there is the cells, they are arranged in the form of sheets. Okay, and these cells, they are, their cytoplasm is cleared. Okay, and their cytoplasm is cleared due to the storage of what I already told you. The cytoplasm is cleared due to the deposition of the fat, deposition of the glycogens, and these cells with clear cytoplasm, they can be stained with the PAS as well as oil red O stain. Okay, so they are PAS positive as well as oil red O positive. Okay, so that is the point. Here you can see the image. Okay, these are the tumor cells with clear cytoplasm. So these are the tumor cells with clearing. Okay, and you can also see here next one, that is your papillary renal cell carcinoma. Okay, papillary renal cell carcinoma is the second most common renal malignancy, and in this you can see these tumors are arranged in the form of papilla. Okay, they are arranged in the form of papilla, and these papilla are actually lined internally by the these foamy macrophages. Okay, they are lined by the foamy macrophages, and next they consist of you can see here the clear renal cell carcinoma as well as papillary in the form of these finger like projection. Okay, now they are lined with the cuboidal cells. Okay, they are lined with cuboidal to columnar tumor cells. Okay, internally. Now next will be the chromophobe renal cell carcinoma. So this chromophobe renal cell carcinoma, you can see the very important feature is the perinuclear halo. Okay, so in the nucleus there is halo. Okay, this space is present and the nucleus is just like the resin. So the is also known as resinoid nucleus, and the cells are polygonal in shape, just like the cells of the plant. Okay, that is polygonal cells. So that is a chromophobe renal cell carcinoma. Okay, they are totally polygonal cells. You can see here they are polygonal cells with the resinoid nucleus, as well as there is presence of perinuclear halo. Okay, there is presence of perinuclear halo, and this is the chromophobe renal cell carcinoma that is stained with Hell's colloidal stain. Okay, Hell's colloidal stain. Okay, Hell's colloidal iron stain. This is important MCQ. These are the things I have told you about how to identify the image based question of the tumor of the kidney. Okay, so this is very important. Okay, so I think you have understood every concept of the renal tumor. I think you can get this note from the description. Okay, there is link, you can get the note as well. Okay? If you like the video, then please subscribe the channel and share among your friends. Okay, it will be helpful for every students. Okay, it will give the concept of every topic. Okay, I will